The poster title is Consensus on the World Health Organization International Classification of Functioning, Disability and Health Comprehensive Course Set for Deafblindness. The authors are Walter Wittich, Shirley Dumassais, Atul Jaiswal, Tosin Ogedengbe, Ricard Lopez, and Sarah Granberg. The affiliation for Wittich, Dumassais, Jaiswal Ogedengbe is the Université de Montréal, School of Optometry in Montreal, Canada. The affiliation for Lopez is the European Deafblind Network in Barcelona, Spain. The affiliation for Granberg is Örebro University, School of Health Sciences, Audiological Research Center in Örebro, Sweden. This is a poster presentation at Vision 2025, the 15th International Conference of the International Society for Low Vision Research and Rehabilitation that takes place from September 8th to 12th, 2025 at the Palazzo dei Congressi in Florence, Italy. Purpose: the World Health Organization's International Classification of Functioning, Disability, and Health is a framework designed to conceptualize human functioning. Its coding system, however, is difficult to use, given the abundance of over 1,400 available codes. Therefore, course sets can be developed that focus on the unique characteristics of a specific disease or condition. Our team has completed the necessary studies to present the comprehensive course set for deafblindness. Methods. In October 2024, 26 experts on deafblindness, individuals with lived experience of deafblindness, family members of persons living with deafblindness, health service and social service providers met in Salou, Spain. The purpose was to complete the process of finding consensus on the course set for deafblindness based on the review of data collected over 4 predetermined phases: a systematic literature review, interviews focus groups with persons living with deafblindness and their family members, a survey with experts in the field, and a multi-site clinical assessment study. All phases together included data from 54 countries across the 6 regions of the World Health Organization. The event provided accessible communication, e.g., visual and tactile sign languages, and AI live transcription. Results. Throughout the 2-day event, 218 codes were agreed upon, though consensus vote, 75% plus, from the over 1,400 codes available within the International Classification of Functioning, Disability, and Health that best identify the functional priorities of individuals living with deafblindness. The first version of the Comprehensive International Classification of Functioning, Disability, and Health Core set for deafblindness is now available online. The comprehensive core set, 218 codes, provides a detailed list of all key factors to assess or manage deafblindness, supporting thorough care and policy planning. The intermediate core set, 137 codes, summarizes the comprehensive core set by grouping all its items into a more concise list, facilitating interprofessional communication. The brief core set, 33 codes, is a concise version that highlight only the most essential areas for quick and efficient individual clinical evaluation. Conclusions. This first version of the comprehensive core set builds the foundation for the presentation of a brief core set and the development of a plain text and summary to be recorded in several sign languages. Once all preparatory studies have been published in peer-reviewed journals, the core sets will be submitted to the International Classification of Functioning, Disability, and Health Research Branch for ratification and publication on their website. Next steps include the validation of the core sets and the development of specific core sets for children and youth living with deafblindness. Funding. This project and its consensus conference has received research funding from the Canadian Hearing Services, the FRQS Vision, Sciences Research Network, the Centre de Recherche Interdisciplinaire en Réadaptation du Montréal Métropolitain, the Dumassais de Barcelona, Deafblind International, and the Deafblind Ontario Foundation, with partnership funding from the Institut Nazareth et Louis Braille du Centre Intégré de Santé et de Services Sociaux de la Montérégie Centre and the Centre de Réadaptation, Lethbridge, Layton, Mackay, du Centre intégré universitaire de santé et de services sociaux du centre-ouest de l'île de Montréal.